guys, it's Dr. Vidal here, and we are back with Tuesday Tips. We try to meet every Tuesday afternoon, discuss different topics, and get to answer your questions. Thank you so much for all of you guys that joined last night. Last night we had a very special live joining a patient of mine that she's having surgery very, very soon. She was sharing her experience, and we got to answer a lot of questions about her pre-op, also about the post-op, and massive weight loss body contouring surgery. So if you didn't get a chance to see it, check it out in my page. It's in Spanish, but there's a lot of questions I answer there, and if you do have any questions about anything, you can DM me and I'll gladly get to answer those, okay? Today we're going to talk about the big no's before surgery. We always talk about what things we should do, how we prepare, what things we need to get before surgery. But there are a few things that we should avoid before surgery, and I think that's as important as the things that you need to do and get before. So let's focus on the big no's today, and then I'll get to answer questions. The first one, number one, the most important one, nicotine. Nicotine is a very, very bad for healing tissue. The nicotine, what it does is vasoconstriction, so it shrinks the blood vessels. And our healing relies on the blood supply, the blood bringing the nutrients so the incisions heals. And you would think, but liposuction doesn't have incisions. Why do I need to heal that much? You don't have incisions on the outside, but there's actually a lot of healing involved. Just imagine a cannula going in and out throughout your entire torso. All of that needs to heal. So even though you're not seeing the incisions on the outside, the amount of healing that needs to occur with liposuction is actually more than with any other open surgery that just needs to heal the incision. Okay, so don't think that liposuction is less. So for every surgery, it's very important to avoid nicotine products. Okay, there's going to be a nicotine test the day of surgery. Why? Because for me, safety is extremely important, and maximizing your results is very important as well. So I'm not going to perform surgery on you because I think it's a harm. Okay, I'm doing you harm if I'm doing surgery and you're on nicotine, because nicotine is something elective that you can stop and improve your results and decrease complication rates, okay? When to stop it? At least 30 days. But if you are a chronic smoker, you should stop at least 2 months before the surgery to make sure that you flush all that nicotine out of your body. What's the other important thing? Remember, there are other products that contain nicotine. It's not only on cigarettes, okay? Vaping, hookahs, all of those contain nicotine. Even if you're smoking marijuana, sometimes those paper rolls and things that people use for the devices that they use for smoking the marijuana have nicotine in them. So be very, very careful not to use any products, gums, patches, all of that have nicotine on them, okay? So try to avoid. And if you're getting nicotine through secondhand smoking, try to stay away from that person. Please tell that person, family member, next of kin, anyone, please do it outside. Don't do it when I'm with you for at least 30 days before, just to make sure that your nicotine test is negative and you have the best outcomes possible, okay? So nicotine is number one. Estrogen. No estrogen 30 days before the surgery. Why? Estrogen increases the risk of blood clots, okay? We have risk factors such as general anesthesia, people flying in, not moving enough after surgery. All of that increases the risk of blood clots, but estrogen, especially estrogen supplements such as OCPs or contraceptive pills like the NuvaRing, all of those that have estrogen on them, it's very dangerous, so you should stop it 30 days before the surgery, okay? And be careful, because the other urine test that I do the day of surgery is a pregnancy test, okay? So even though you're gonna stop your contraceptive pills 30 days before your surgery, you have to be careful, because if you're pregnant, I'll have to cancel your surgery because it's a risk for the baby, okay? We don't wanna put that baby unharmed with the general anesthesia and the medications that we give, okay? So no nicotine, no estrogen. Stimulants, weight loss pills, stimulants like caffeine-based products and Adderall should be stopped 30 days before the surgery. Why? Because this affects your heart rhythm, okay? We want your heart to be like a baby, perfect for surgery, okay? So all these products, stimulants, affect your heart rate and your cardiovascular system and may affect your results and your tolerance for anesthesia. So you'll stop all of those 30 days before the surgery. Anti-inflammatories or NSAIDs or aspirin 30 days before because they increase the risk of bleeding, okay? Plastic surgery is different than any other procedures or any other surgery. Some people say, oh, but I had X or Y, my appendix removed while I was on NSAIDs or estrogen. Why is it different for plastic surgery? One, the extent that we're doing, usually, like for example, liposuction, we're doing an entire torso of healing. Tummy tuck, I elevate all the skin up to your bone in the chest area from the lower abdomen. So it's more healing than just incision getting in to remove a cyst or an appendix and getting out. So the amount of healing involved in plastic surgery is different. So that's why the bleeding risk is higher, okay? I'm dealing with skin and fat, which is an area that bleeds a lot, more than actually entering your abdomen. So risk of bleeding is higher in the what we call soft tissues, and that is why no NSAIDs. What's NSAIDs? Like ibuprofen, Motrin, Aleve, naproxen, all of those are NSAIDs. So you should avoid NSAIDs. If you have a headache, Tylenol is okay, but no NSAIDs for 30 days before the surgery. Same thing with aspirin. No aspirin for 30 days before, okay? Multivitamins or supplements. Why? The majority of the natural supplements that you find over the counter and on pharmacies, they contain multiple ingredients that are not FDA regulated, okay? When you have supplements and it's not a drug, it doesn't have to be regulated by the FDA. So the amount of product, of milligrams of that contains that medication it's uncontrolled. We don't know. And the majority of the time, they add supplements that increase risk of bleeding, okay? So like bromelain, garlic actually is one of the natural supplements that increases risk of bleeding that is usually added in all the multivitamins and supplements that we find over the counter in pharmacies. So that's the reason why we stop all multivitamins. What are the exceptions? Exceptions: vitamin C, iron and folic acid. Those are going to start 30 days at least or 45 days before the surgery, so you're ready for your surgery day. Also, if you're a bariatric patient and you're taking supplements for your bariatric, post-bariatric procedure, you should continue your supplements because that is going to improve your wound healing ability, okay? So if you are post-bariatric or you're taking the vitamin C, iron, and folic acid, that's good. The rest, stop them for 30 days before the surgery, okay? So those are the most important ones. Remember, 30 days is to be safe, okay? There's some people that say, oh, but NSAIDs only last in the body 48 hours. Aspirin is 10 days. Yeah, but we don't want to increase the risk, and we want to be safe. So it's better to do it 30 days. You clean yourself and clean your system from anything that can increase your complication risk, and you're ready for surgery. Okay? And don't freak out. You're gonna get a call from the pre-op team, and they're gonna one-on-one review all of this, and they'll go into detail to what medications you are taking, and specifically from your medications, what you need to stop or continue. Okay? So I'll get some questions now.
Okay, on YouTube's on fire.
Yay!
Yes. So can you take laxatives?
Laxatives are okay to take, but at least do it 1 week before the surgery. The reason for laxatives or caffeine, alcohol, all of those things may dehydrate you, okay? So I don't want you to be dehydrated before the surgery. I actually want that tank full. You should be very well hydrated before your surgery. So Don't try not to drink caffeine the day before, no alcohol for at least a week so you clean yourself and you're very well hydrated for your surgery.
What about bone levels from mild dehydration? BUN, bone levels?
Oh, okay, BUN levels?
Yeah.
The BUN levels are going to be checked. That's checking your kidney function. We are going to check because that's one of the blood tests I send. CBC, BMP or a chemistry panel, and in the chemistry panel we check your BUN and creatinine levels, and that tells us your kidney function, and definitely that should be normal and within normal levels, but I still encourage you to get well hydrated, even if that number is normal, right? That number might be good, but you still need to hydrate and be ready for the surgery.
Okay, can I take collagen?
Collagen is okay, yes. Collagen supplements is okay.
Can a tummy tuck scar revision be done under local anesthesia?
It depends on the extent of the revision, okay? If we're only doing dog ears, so dog ears is a little bit of extra skin on the edges of the incision. If we're only doing dog ears, most of the time I do it here in the office under local anesthesia without the need of, general anesthesia or any complex recovery. But if we're doing the entire incision, then yeah, that's gonna be a little bit uncomfortable to do it under local and you might need to go under.
Okay, this is Sbelta Body. They say, hi, we love Dr. Vidal, you're the best.
Thank you. Love it.
Okay, can you do the eyelid skin removal under local?
That is a possibility. Eyelid surgery can be done under local, but it's a very delicate surgery, very near your eye. So you have to be cooperative. You have to be a very calm person. So that's something I discuss with you on a one-on-one basis if you want to do it under local. If you want to, we can definitely do it. You're gonna feel the local anesthesia part, so a poke and some burning. After that, you're not gonna feel pain, but you are gonna feel me pulling and tugging and suturing, okay? So you have to be calm and not moving around because it may affect your results. Most of the time it's better to do it under local with sedation. So sedation is very similar to when you get a colonoscopy, for example, they give you some sedation through the vein. You're not completely asleep, but you're more calm.
Okay, this one says,
Yeah.
8 weeks post-op, I look curvier from one side than the other. Why is that?
You're still swollen. 8 weeks after surgery, you still have swelling. And remember, no one in this planet is completely symmetric. We're all asymmetric, and that is beautiful, okay? If you put the two hands in front of a mirror, both of them are different. Our eyes are different. The mouth, every single one side of the body is different than the other. So there's always going to be some asymmetries. And you would say, why? But I didn't notice it before. Because before you had more fat. After everything is defatted and taken away, you're going to notice those asymmetries or tilts in your hip a little bit more. Something that maybe you'll notice, but I assure you no one else will notice.
Great. Okay, we have another question here and says, I gave birth 4 months ago. Can I schedule my consultation now?
Congrats on that. Yes, you can, but you shouldn't have surgery until you're 6 weeks out. And remember, you're still healing. You took 9 months to grow that person, okay? So give time for your body to kind of bounce back, retract, and recover. We can have the consultation, but things might change in the next few months until your surgery day, okay? And if you're breastfeeding, you should wait, and you're considering a breast procedure, you should wait at least 6 months when you finish breastfeeding. Same thing, we can have the consultation, but things might change when you stop breastfeeding and you give time for your breast to deflate, recoil, and see what happens.
Okay. Could you please explain about the massages?
Yes, of course. Massages are extremely important. It should be done by a professional. We're not doing massages just to feel a little better. No, the massages are actually for removing that excess fluid, helping with the swelling, helping with skin retraction, avoiding fibrosis or scar tissue formation. So they're actually very important and should be done by a professional massage therapist. It should be someone with experience with post-operative liposuction and lymphatic drainage massages, okay? How soon you start? The next day, and you should have one a day for the first week. Usually after the first week, people can start to wean them off. Everybody's different. Some people need a little bit longer.
Okay, this is at YouTube too. I think it's the last one here and says full back lipo. Does that cover lower neck or hump removal?
No. So the back lipo is up to the level of your armpit. Okay, so from here down. So it does cover the bra line or the bra rolls area, but it does not cover the upper back hump area. So if you do have excess skin in that area, that's an add-on.
Okay. And here, how long does it take to be clear for surgery?
To be clear, after you submit everything, it's going to be a couple of days. It depends on how many charts we have, and but usually within a day or two. Give us 3 to 4 business days so we evaluate everything. Remember, it has to go through me, and it also has to go through our anesthesia providers. Both of us evaluate all the charts, and Dr. Earl evaluates his with anesthesia providers. So it takes a little bit long if we have a bunch of surgeries together, but it should take a couple of days. Awesome. So thank you guys for joining. Thank you for the questions. Again, go to my page and check out the live that I did yesterday with Gisela. Si tienen cualquier duda, cualquier preguntita, la pueden poner en los comentarios o me lo pueden mandar a mi cuenta y con mucho gusto se los respondo. And I'll see you guys next Tuesday tips. Bye guys.